Veneers and Lumineers, Dr. LeBlanc. What's the difference? As patients, we're confused about it. It's all cosmetic dentistry, and, we kind of know that. To me, they're all finger clip nail on type of thing. But why don't you tell me what this is all about, this terminology?
Well, Lumineers, to simplify, Lumineers is a brand name, much like Kleenex and facial tissue. So you generally don't say, hand me a facial tissue, you say, hand me a Kleenex, but you could be getting a Kirkland brand facial tissue. Lumineers is a brand, and it's a well-marketed brand, and we've used that brand very successfully here at Portola Dental. But a veneer is a very thin porcelain shell that gets bonded to the front surface, or the surface that you see of your tooth. So where are they great? For people that have really discolored teeth, broken teeth, tetracycline stained teeth with a lot of gaps. It just makes you from smiling with your hand over your face to just wanting to smile any chance you get. And it really is one of the most rewarding things we do, because when we do a root canal, we get people out of pain, but they don't gush every time you see them for the next 10 years. When you take somebody, and of course the worse they are to start with, the makeover shows don't start with someone that's gorgeous and make them a little bit more gorgeous. They take someone that isn't. So with teeth, somebody that has a lot of spaces, really discolored teeth, broken down teeth that are just embarrassed, they get the veneers done, and it's absolutely life-changing, and it's a joy to be a part of that.
Wonderful. And what should a person be aware of getting this type of work done? What should he look for? Which question maybe he should ask his dentist? Things like that. Tell us.
Well, Helmut, I talk a lot of people out of veneers because, number one, oftentimes people say they don't like their teeth, and they look at little tiny flaws in their teeth, but really when I look at their teeth, I say to them, and I think to myself, boy, your teeth are pretty gorgeous. You've got nice teeth. They just happen to be brown, or they happen to be yellow. So we do a very simple bleaching procedure. They get their teeth nice and white, and they go, wow, Dr. LeBlanc, you were right. My teeth are gorgeous. So first and foremost, I talk people out of veneers a lot more often than they actually do the veneers. But for someone that does them, it's a very easy procedure. It's a painless procedure. With the higher tech veneers, such as the Lumineers, they're very thin. So whereas graduating USC 23 years ago now, when we did veneers, they were thicker veneers, and we had to reduce the tooth. In other words, it was irreversible. We had to grind some of the tooth down. A lot of times today, we don't have to grind the tooth, or if we do, it's very minimal, which to me is fantastic. It's just much more of a conservative procedure, and it turns out looking really great.
So it's about looks.
It's all about looks. You don't have a cavity in your tooth and say, let's do 8 veneers. Yeah, it's all aesthetic, no question.
And of course, aesthetics do make a big difference. I remember I was running around with one tooth which started getting discolored simply because it was going bad, like a tree trunk,
right.
You know what I mean?
Yeah.
And it was kind of on the side. It wasn't really, but, over a couple of years, without really realizing it, you start not smiling, you start smiling crooked, you don't realize you put your hand there, and the time I realized it was when it got fixed, and all of a sudden I would be in the mirror going, this looks good. Oh, wow. Then absolutely. I realized how bad that discolored tooth actually was.
Yeah.
It was just one, and it was relatively to the side, and yet it took me probably 3 years too long to fix it, and I still admire it.
Yeah. Well, there was a family member, this was probably 20 years ago, with beautiful teeth, absolutely beautiful teeth. But he would laugh, and he would laugh like this all the time. And as a close family member, I really never noticed that. But then one day I said, let's bleach your teeth. We bleached the teeth. It was unbelievable how white they got. And now, where his teeth were were a non-item in his features, mostly because he'd cover them when he laughed, now when he smiles, it just lights up his face. It's unbelievable what a difference it can make. And that's what the patients say. They go, wow, I went to work, and people were saying, what did you do? Did you do your hair? You look great. Did you lose weight? So oftentimes people won't notice exactly that your teeth are looking a lot better, but they come out and say, you look great. So
right.
Yeah, it's neat to see.
Yeah, well, it's a confidence factor with no doubt. It's just like
Yeah.
wearing a new suit, a new shirt, and you walk an inch taller, and it makes a difference. And not for nothing, they call it $1 million smile, right? For some people.
But you can wear an old suit, and if your teeth are gorgeous, it makes up for an old suit.
Right. Well, thank you very much.